So you got cataract surgery and you're enjoying being able to see clearly. When all of a sudden, out of the blue, one eye or both eyes are cloudy again. You think, what? I already got rid of that filmy cloudiness with the cataract surgery. What is this? Well, it's called posterior capsular opacity, and it's very common to occur in patients following cataract surgery, anywhere from 2 weeks following surgery to many years later and any time in between. Fortunately, they already have a fix for this. It's called the YAG laser. It's easy and it works. I've now had it done on both eyes. I'm GloryB and this is GloryB-TV. I had cataract surgery on both eyes 2 weeks apart in early 2022. They did the left eye first. One day after they did the right eye, my left eye went cloudy. I was perplexed about this, but I had an appointment scheduled with the doctor for the right eye follow-up and asked him to check my left eye. That's when I found out that a common occurrence following cataract surgery is to get posterior capsular opacity. Now, more cloudiness in the eye. Oh, yay. As I said a minute ago, the good news is there's an easy fix for it, and it's the YAG laser. Now, the doctor told me at the time that this can happen shortly after cataract surgery or several years later. He also said the younger a person is when they have cataract surgery, the more likely they'll later need the YAG laser to get rid of the cloudiness that appears at a later date. I created a whole video about my experience with the YAG laser at that time for this eye. In fact, I needed to wait to have the laser treatment for about 3 months to ensure the cataract lens was firmly in place. So then fast forward to 2024. It seemed like my right eye was also getting cloudy, but it wasn't as bad as the left eye had been. I was close to getting on Medicare, however, so I wanted to wait for that. It takes quite a while to get an appointment with this doctor, so I booked it way in advance for February 2025. I also had a few other eye issues I wanted to discuss with him at the same time. Some things I wasn't sure were eye issues or skin issues, and whether I was starting to have dry eye in one eye. I remembered the first YAG laser treatment was much more expensive than I had imagined. Now, before Medicare, I had a huge deductible. I looked back at my records and then the reduced contractual price of the YAG laser with Blue Cross Blue Shield was $650. And that's what I had to pay because I hadn't yet met the deductible. Now, a week ago, the eye clinic called me and told me to contact the eye surgery center, which is right next door, to discuss the cost of the YAG laser procedure because that's the group that bills for the YAG. Well, I called them and they said the price is $4,023. Of course, that's the full retail price. It's also my first visit anywhere after starting on Medicare, so they're kind of the guinea pig. I do know that for 2025, the Medicare deductible is $257. So we'll see later how the money plays out. Now, in my first video about the YAG laser, I told people the procedure itself is really a nothing burger. It's the cost that will give you a heart attack. And the worst part is leaving the clinic with your eyes dilated. I decided to not wear any makeup that day, which now it's Sunday. This was on Friday. Even mascara, I didn't wear it. I wanted the doctor to be able to see all my other skin issues I'm having, see my eyelids, no eyeshadow, yada, yada. So when he took a look at the cloudiness in my right eye, he agreed that it had a film over it and that it wasn't too bad. I agreed with that. I knew it wasn't nearly as bad as my first eye had been. The good thing is that with a full eye exam, he said everything from my eyelids all the way back through to the eye area, the back of the eye area is healthy and working normally on both eyes. So here's my second experience with the YAG laser. First, in case you missed my other video, I put in this clip of someone else having the procedure done. I didn't have anyone with me to take video of my own YAG procedure, but this one is really a good option to watch. You hear these popping sounds as the doctor uses the laser to break up the filminess. You can blink during this YAG laser, which I found amazing. It's kind of like the doctor's playing a video game where he's blasting out the cloudiness. One of the after effects of the YAG laser is getting floaters in the eye for a few days afterward. The doctor said the floaters that will appear in my second eye might be completely different compared to the floaters I had in my first eye a few years ago. In other words, I might not have the same experience as I did in 2022. So far, it's been 2 days. I only saw one small floater yesterday, and just as I was setting up filming, I saw one more over here. So, in comparison, I saw many floaters in my left eye in 2022 over a number of days. Now, I don't live near this clinic any longer. And it was a long day. I dropped off my car to get new tires at my dealer, and I was driving a loaner car. So after I left the clinic in bright sunshine with snow on the ground, I drove to my former gym to use the locker room sink area to put on my makeup. Oh, yes, I didn't leave the house without my makeup. And then I went to get something to eat. Let's see, what time is it? It's 1:40. My appointment was at 10. I finally got out of there at 12:15. Stopped to put on my makeup and, just had lunch at Chipotle. My eyes are still so dilated. I don't know if you can see how big my pupils are. I have doll's eyes. So, my car is getting new tires today, and I'm in a loaner, and they still haven't called me to say it's done, so I have some errands to do. But yeah, driving home, it's when the sun bounces off car windows, that's like the hardest thing. I did get an extra pair of something, more eyeglasses that they have that you put them inside your glasses and they wrap around your face, but they make things so dark. I thought it was a little too um it just made everything just off, and I have a lot of driving to do to get home later today. So, yeah, but he said my eyes are doing good, and, I'm glad I did the YAG on the other eye. So we'll see if I have any floaters later today that could last for a couple days. Yeah, we'll see. I had this procedure done on a Friday, as I said. Now, by Saturday morning, my vision in the right eye was clear. Today is Sunday, and it's still clear. And watching the video I did in 2022 about my first eye, I said it would get clear, and then it would get cloudy again, and then it would clear up, and then it would get cloudy. It did that on and off for 2 or 3 days, and then it finally cleared up for good. Now, but with the second eye, once the dilation of the eye started to wear off later on Friday, it was already cleared. The easiest ways for me to test the clarity is being in front of my two big computer monitors or watching TV. Now, I don't have a big TV like a lot of people do, but if you want to test it, you're going to have the YAG, or you even wonder if you have the filminess. What you can do is sit in front of your TV or computer screen and just close one eye after the other and compare. Do you see cloudiness? Is it filmy in one of the eyes? And that will tell you something. And then if you have the YAG laser treatment, then when you get home and you're watching TV for the next few days, hopefully you'll get to the point finally where they're both clear. It's so exciting. Or the other thing is filming here in this filming room that I have, my studio with my bright lights. That's where the cloudiness would really stand out to me. So these are the things that made me notice the filminess the most. While that and driving at night, which I haven't done yet, the filminess is much more noticeable with headlights and traffic lights at night. So what other eye issues did I want to discuss with him? Well, last fall, a viewer here on YouTube told me she wondered if my eyes had a Demodex issue, especially my left eye. I hadn't heard of Demodex before, so I looked it up. Ugh. There are several optometrists and ophthalmologists on YouTube who talk about Demodex. We all have them. They're microscopic mites that hang out around the eyelashes. But for some people, there are too many Demodex mites hanging out where the eyelashes grow out of the skin. The only way to definitively say that a person has Demodex is for the patient to be at the doctor's office and the doctor plucks out an eyelash and looks at it through a powerful microscope. I didn't do that. The treatment to get rid of Demodex is over the counter. Most people use the Clearadex towelettes and the OcuSoft Oust Demodex foam cleanser. So I decided to go ahead and purchase both products and to do a full anti-Demodex process last fall. Here's a photo of me before I started using these two products. It's my left eye where I thought I had a problem, although I did treat both eyes. These products really sting a lot. People writing reviews on the towelettes had a lot of good advice. And if they really had Demodex, they wrote that this cleared it up completely. Now, when I finished with the products, my eyes look like this. Little better. On Friday, my ophthalmologist didn't think I had Demodex or blepharitis, right now anyway. He didn't pluck an eyelash. I'm relieved about that. I can't imagine having your eyelash plucked out. Pluck an eyebrow for me while you're at it, but not an eyelash. He's not sure what the left eyelid thing was about. Sometimes it would be a little bit swollen. Yeah. But tomorrow I'm seeing a new dermatologist, so that's my next venture. The other issue I wanted to discuss with the doctor was that for several weeks, I've seen some unusual tearing in my right eye in this inner corner, but not all day. I mainly see it when I'm putting on my makeup in the morning, but I wondered if I was having a dry eye issue. Now, thankfully, he said he didn't think I'm having dry eye like you see on TV commercials that advertise for dry eye medication. Instead, he told me to do this. He told me twice a week while I'm in the shower, wet a washcloth with warm water and put it over my eyes for a minute or two. He said, just stand there in the shower and let the warm water just go down your back and put that on 2 days a week. And he said to clean my eyes using the Johnson & Johnson baby shampoo, use 1 drop, and to wash my eyelids and lashes with like 4 swipes of the shampoo. He said to do that twice a week and to not use any other brands of baby shampoo, just the Johnson & Johnson. If you see cloudiness or filminess or in one or both eyes anytime after you have cataract surgery, schedule a full eye exam with your eye surgeon. They should do a thorough eye exam first to determine the health of your eyes before using the YAG laser. If you look through the comments on this video or comments on my previous video, you'll see that most comments from people who had the YAG laser procedure are positive. It's so great to be able to see clearly. Check out my entire playlist of cataract surgery videos or tap one of the images on the right side of your screen, and I'll see you in the next video.